Good afternoon and welcome to Valley Views. I'm your host, Glenn Edison. We're certainly glad to have you, and we want to thank our sponsor, BTC Fiber, for having us. They have us on BTC Fiber's YouTube page as well as local cable channel 18, so you can see our programs on both of those venues. So tune those in for us. Today we have with us local chiropractor Monty Long. And Monty, thanks for being with us today. We appreciate you being with us.
Thank you.
And of course, most of you know Monty is the owner of Affordable Chiropractic. And Monty, you just had a recent celebration for a number of years you've been in business. What was it, 20?
20 years. Yeah, this July, 20 years.
Wow.
Yeah. Doesn't
seem like it, does it?
No, not at all. But it's been a really blessed career, and I'm happy to help the people of this valley and this general area.
Well, I know when you first started your schooling, for example, in chiropractic, what made you choose that field?
Actually, our family story that led their entire extended family into chiropractic was back in the 1950s. My grandfather had some type of incident in which he became paralyzed temporarily, and the chiropractic care actually restored his ability to walk. So from that point on, early on, in I believe it was the 1950s, a lot of our family, aunts and uncles and cousins were patients, and then Dad also had a football injury when he was in high school, and then of course Grandpa insisted to go to the chiropractor. It gave him relief, and then fast forward to I was weightlifting for football in high school, and had a lifting injury, a squatting injury, and Dad insisted you're going to go see the chiropractor, and it gave me fantastic relief. And I actually started college. I was pre-med, so a few years into my undergrad studies, I had another episode of back pain. Went to the chiropractor for a second time, gave me tremendous relief, and that's when my mind started shifting to think chiropractic versus medical school.
Well, in chiropractic versus medical school, and I'm not downplaying any doctor at all,
right.
But with chiropractic care, over time you can see results with that versus a doctor who may have to try one medicine to see if that works for whatever condition. If that doesn't work, they have to go to plan B, and
exactly.
It might take some more time for them to get stuff right for you. But with chiropractic, you can kind of work it around and see some results.
Especially for those musculoskeletal conditions. And I want to make sure we're clear. Healthcare is a team effort.
Right.
Everybody needs their medical doctors, their nurses, their chiropractors, dentists, physical therapists, and it should be a collective team effort. But that was my personal story, that I was headed toward med school, and I think the Lord shifted my path a little bit, and I'm happy that He did, because I really enjoy this. But that's my personal story, and it's very, very safe and very effective. So it's been a great career, and I can't believe it's been 20 years already. But what a blessing to be able to help that many patients in this area.
Well, people also don't need to be under the assumption that just because it's a pain that it might be something that you could help, because it could be something a little bit more severe.
Right.
That needs to, like an MRI or something that's out of your range of specialty,
yes. Yeah.
Something that needs more attention.
Right, and I routinely refer out to the MDs for a second opinion for anything that I think is out of the scope of my practice. We routinely order X-rays and MRIs and CT scans, and we're well trained to know what our scope of practice is and what our limits are.
Well, because you wouldn't want to mess somebody up if there was something that was really hurt, and then you made an adjustment and made it worse.
Exactly. Yep.
And of course, I know you don't do that, but that's, like you say, precautionary.
Right.
And excuse me. Now I know a lot of people, and myself included, sometimes when they get pains, they try to tough it out and think, well, that'll go away, and they just kind of attribute to maybe being old or just aches and pains that maybe they've had them before. But it could be something as small as a nerve just pinched, and then it could be a vertebra or something out of whack.
Yes, yeah, and we were talking from very early on, first couple quarters in chiropractic school, that pain's a warning signal, just like the check engine light on your car. Don't ignore it. It's there for a reason. Pain's not a bad thing. It's there to signal that something's causing that problem. There's an underlying reason. You need to investigate and see what it is, and get it stabilized and fixed. And it's not anything to ignore. It's pain as a warning signal, just like that check engine light on your car. That's the classic analogy we've used for years, is how many people cover up a check engine light and ignore it and keep driving, then you're probably headed for bigger problems.
Right. Well, what are some of the, let's say, the worst case scenarios you've seen over your 20 years?
There's the good thing is, statistically, most of those severe cases never make it to the office. They usually go to the emergency room. They go straight to the MD and they get transferred to the emergency room. But we have seen a couple of cases of that called equina syndrome. There's some where patients have to have immediate referral for emergency procedures, but it's very rare actually. And we do a really good thorough patient history, and by the time we finish the history and the exam, if I see an immediate need to refer a patient out, then they go straight to the MD or to the emergency room or to the diagnostic center. So,
well, you just have to be careful,
right?
And of course, I know you stay busy.
Yes.
You have a constant flow of new customers as well as repeat customers, do you not?
Yes. Yeah.
And I think, if I'm not mistaken, it's just you and maybe 2 other chiropractors here in town. Is that right?
Yes, that's correct.
Excuse me. And so, with the number of people, I mean, there's. Do you treat? I should ask you this because I've not seen this. Do you treat like young people, children?
Yes. Yeah, we've had our daughters were actually just a couple days old when they got their first adjustment, and that may seem strange to some people, but especially the technique that I use is really gentle. There's a lot of research that went into the instrument that we use and the analysis that we use, and so many of the general public don't understand that modern day chiropractic is very different from what most people think.
Right.
And those old techniques they still work, but I choose to use. It's a matter of doctor preference. I choose to use those modern techniques. So we had patients as young as 2 days old, and my oldest patient ever was 96, and she came in the office. Actually, she was in a wheelchair. Her son was a senior. He was a patient, and he asked one day, "Can you help my mom?" I said, "I'll certainly try." So it improved her quality of life for the time that she had left. So we've seen everyone from 2 days old to 96 years old, and like I said, the technique that I use, the primary technique, is called Activator Methods, and it uses a handheld instrument. I'll show you in a few minutes, but it gives me the confidence to know I can help patients that are the older seniors and the really young patients and even pregnant patients. That's another category where those ladies need relief from first trimester all the way through, and research has proven it's safe all the way through 3rd trimester. We actually have special tables that accommodate the baby, so the patient can lay face down and still be adjusted all the way through, literally up to the day of delivery.
Well,
yeah, and research proven it's very safe and effective. It gives them a lot of relief and increases their chances for having an easier delivery.
Well, that was one thing you was talking about your instrument. I was going to ask you about that because I know I've been to some of the old ones where they adjusted you and popped you around and didn't feel good.
Right,
a little rougher.
Right, and like I said, those techniques work, but I try to put some humor to it, and I said you can drive a T model if you want to, but most people everyday vehicle, they want to drive a modern car. This is one of the modern techniques, and I'll show you what the instrument looks like. It's called the Activator Methods technique, and that instrument. Now we're up to the 5th generation of this. It's a spring-loaded percussion instrument with a soft rubber tip on it, and sends a really gentle but a really fast percussion force through the muscles in just the right direction and the right speed to reset the vertebra back in place. So much more gentle, much more comfortable for especially patients in pain, and like I said, the older seniors, and some people are in considerable pain when they come in the office. And I think this is more comfortable and more precise to use a modern technique than the old manual adjustments, which they work perfectly well, but that's my preference, and most of the patients really appreciate that. Yeah,
I'm sure they do. I am sure they do. Now, is there a case where maybe someone might not be in pain, but they need some adjustment? Do you do patients like that?
Yes. Yeah. Our professors used one of the mottos they used was, "Pain is the first thing to go and the last thing to show." It's the last thing to show when there's a problem and the first thing to go away once you start treatment. Like a toothache. Our classic analogy is, do you brush and floss and go for dental cleanings before you have a toothache? Of course you do. And the general public knows they should do that. That's the message we're trying to get out is, come and get checked before you have symptoms, before you have pain. And because I have a detailed set of tests and analysis that can find the pinched nerves. Common term that almost everybody's familiar with is pinched nerve. The technical medical term is called subluxation, but we're talking about the same thing. They're synonymous. But we have those special tests that can pick up on those misalignments that are pinching the nerves way before they become painful and symptomatic. So if you wait till it's painful, it's kind of like waiting till there's a toothache before you brush and floss or go for a dental cleaning.
Yeah, and a lot of times, I know just for myself that sometimes it's just been a little thing, but then sometimes it's 2 or 3 things that are working together, and
right.
It makes it a little bit more complicated.
Right.
And so, do you think that, of course, you being a chiropractor, do you think people should come maybe on a regular basis every so often to get checked?
Yes. I even remember when dental cleanings were once a year. And at some point, then the research comes in and says, no, that's not often enough. You need to come in every 6 months. And by doing that, the whole general population, I'm sure it reduced all the severe dental procedures to significantly by coming in twice a year instead of once a year for the cleanings. And everybody should brush and floss at home. So our parallel to that is have the patients do their exercises at home, some gentle stretches and exercises. It's kind of your spinal hygiene at home. And then come in for a routine evaluation, and if you need the adjustment, we know that once I examine a patient, analyze them on the table. But anywhere from every month is perfect. Not everybody chooses to do that, but the research says once a month is ideal and perfect. Some patients come in every 2 to 3 months, but our suggestion is at least every quarter, every 3 months.
Well, most people don't realize, maybe they got a certain way they want to sit in their lounge chair or something, and it's not straight up, it's kind of crooked and everything, and that can throw things out of whack, and sometimes just simple things by reaching over and picking up something that can so it's not always the same thing. So I guess that's what challenges you.
Yes.
For each patient, they're all different.
Yes, yeah, and same patient, different week, different month, different seasons. We're in summer right now, and then when the weather cools down a little bit, we'll see a lot of flare-ups, a lot of sprains, strains, and a lot more incidents like that. But it's interesting, every visit you have to go through a mini history. You have to go through a history review and see what the patient's been doing, yard work, house cleaning, some kind of sport, some kind of activity, and it gives us a clue as to what caused the problem. But you're right, there's a history that has to be done on every single visit.
Now, let me ask this, and I think I already know the answer, but I'm going to ask you anyway. Along with chiropractic help, I know you would probably suggest some kind of fitness program, whether it's walking or whatever, and eating healthy.
Oh yes, yeah. We were taught the 5 pillars of health, and there's different philosophies on this, but in chiropractic school we were taught the 5 pillars of health. What it really takes to make a person healthy is proper diet, exercise, rest, positive mindset, and from a Christian standpoint, your relationship with the Lord, wherever your beliefs are with that, but a positive mindset and spiritual state and a fully functioning nervous system. And without all 5 of those, you really can't be healthy. Right. So we take care of that number 5 for sure. That's our expertise, but that's what we're founded on, is those 5 pillars of health. If you're missing one of those, and the exercise doesn't have to be extreme, and I tell all patients, make sure you're healthy enough, cleared through your medical doctor. If you have serious medical conditions, make sure you're cleared through your medical doctor to do these exercises. But we routinely prescribe the home exercises that are simple but effective. And without doing those, it's really hard for a patient to get well, no matter what kind of treatment we give them in the office, that they have to do their part at home.
Right.
Yeah.
And I know, of course, now there's several, where they didn't used to be, there's several gyms around now, and
yes.
Where people can go work out, but then that also can present another problem if they get injured with the weights or whatever.
Right.
And I'm sure that's there. You've probably seen some of those patients, I'm sure.
Yes. Yeah.
But that's part of it. You have to. Now, we used to hear the term "no pain, no gain," but that's kind of opposite of what it should be, right?
Yes. Yeah, that's old theory.
Yeah,
that's old theory. That's out the door.
Yeah,
like I said, the exercise doesn't have to, just has to be proper for each individual. It has to be tailored for each patient. There's some patients that they manage to get out of the car in the office on the treatment table, and even those patients, I can have them do just basic isometric exercises and certain simple stretches that'll help if they'll do them consistently. It's when people hear exercise, you don't have to go home and do 2 hours a day, but it can be simple, consistent exercise and a good diet overall. and touch on those other pillars of health, that helps tremendously. That's essential to a patient really getting well.
Now I know at your office, because I've been there, you sell the supplements there.
Yes.
The standard process.
Yes.
And actually the other day I was on my YouTube page, and a video came up for standard process.
Right.
And it shocked me. I thought, well, I'm gonna watch this. And it was interesting to know how they do their products, how they plant one field, but then on the other field they plant just, could be grass or whatever.
Right.
And
Right.
they try to keep their products clean. But I know right now seems like everywhere you turn now there's all kind of supplements being sold, and all kind of different meal plans, and just everything out there that trying to make everybody more healthy.
Right.
And
there are many good companies, but it would take a lot of time to keep up with, and do the research. But not all supplements are created equal. And Standard Process has been around since 1929. It's a family-owned company, and Dr. Lee started the company in 1929. It's a beautiful farm up in Wisconsin. So it's whole food organic supplements, and he still holds the patent on the way they process those supplements that makes them really effective. So that's why a lot of chiropractors and dentists and the holistic MDs and different healthcare practitioners that are of that natural mindset use them. Even the veterinarians, there's a whole line for dogs and cats and horses.
I noticed that I didn't know.
But it's whole food organic, and they have that patent on the process of how they make the vitamins. So it's the ingredients and the way that they process them, where the name of the company came from. There's a patent on that process that no other company is able to duplicate, and it makes them highly effective. And that's one of the things that it's easy to tell a patient to go home and straighten out your diet. It's a lot easier said than done.
Right.
It's easy to supplement them. It's easier and it takes less effort to supplement them with a really concentrated food tablet, a whole food tablet of the diet, the foods that they're supposed to be eating, and it supplements and supports their tissues and makes their spinal health improved significantly. Like the glucosamine, a lot of people use glucosamine and MSM and similar products. And I trust the quality that comes from Standard Process because it works. We've known it's worked for decades, much better than a lot of other companies.
Well, all I can say is if you go to Standard Process and you look up that video, it was very interesting because I watched the whole thing and I thought, well, that's stuff I didn't know, because I've talked to you before about some of those supplements, and we've had conversations about the company. But then when I watched that video, I thought, well, that puts it in perspective, and everything. And I thought that's pretty neat. And I didn't, like you said, the veterinarians and stuff, because I saw where they had a whole line of products for animals. And, I thought that was interesting, because you don't think it uses supplements. You don't necessarily think of animals. I know they're out there, but you don't always think about animals. There's more humans around. And excuse me, I'm sorry. For some reason I've got this throat today. When you talking about the supplements, do the supplements, do they just add to, or do they help cut out those doctor visits? I mean, do they? I know they work on some things to improve, like there's supplements like for gut health and all those other things, heart health and things like that. Does that help cut out, or does it just help maintain?
I think it's statistically across the board. If you look at a big enough sample of patients, it would reduce the need for additional chiropractic visits, because you improve the overall health of the person. Like I said, there's target products. Glucosamine is probably our most popular one, because we're dealing with musculoskeletal conditions primarily, and so it rehydrates and retightens the tissues around the bones, around the joints, so it helps support them. But if you make a person healthier, even if somebody has indigestion, you give them a dietary enzyme supplement, it helps improve their digestion. It helps increase their overall health. So statistically, it should shorten the need for extra adjustment visits. We have a lot of patients that are smokers or diabetics or both. And the research shows that if you're a smoker, you require twice as many treatments as a non-smoker. If you're a diabetic, you require twice as much treatment as just a scientific fact. So anything to improve a person's health should shorten the need for additional visits. And we want everybody to get well and stay well and come in on a maintenance visit. And I'm sure the an ideal practice for a dentist would be nobody has cavities, nobody needs root canals.
Right.
Everybody brushes and flosses perfectly and comes in for it, and that's idealistic, but we still work toward that goal of get everybody well and keep them well in that same mindset.
Well, and I know too, when you look at it, of course, I know some of those supplements and other programs, they cost some money. I mean, it's not sometimes cheap, but when you compare that to your health and all the doctor visits you could incur, it probably equals out. You know, it makes it worth its time.
Right, and I'm sure a lot of the viewers may remember the old Fram oil filter commercial from the 80s. And I think it was maybe it was Pet Boys, but it was pay me now or pay me later. You know, you can either, if you eat cheap food, you can, you know, you're either going to pay it now or pay it later. Either pay for good food, pay for good health care, take the time to exercise. So when it comes to your health, you either pay it now or pay it later. And we've seen that's been proven year after year. So I tell patients, get a good quality health care and good quality supplements in the food that you eat, and the standard processed supplements compared to other companies. Shaklee's a good company. There's several others, but they're very affordable for the quality that you get. That's one of the other driving forces that why a lot of chiropractors and holistic doctors use their supplements is they are affordable and they're effective.
Well, and too, a lot of people need to understand too that just because you get one bottle and take one bottle and you think, well, I don't feel any different, that didn't work. It's a process. It takes time, more than just maybe that one bottle. It may take 3 or 4 months or 6 months, depending on the situation.
Yeah, I think in general, society is less patient than what we used to be years ago. Everybody's in that mindset, but that's something we constantly teach the patients is you have to be patient. This problem didn't start overnight. You think it did. We've had so many stories of patients say, I was just sitting in my chair and reached for my coffee cup and I hit the ground in terrible pain. And I said, that coffee cup didn't do that. That was just the last straw on the camel's back. So I use a lot of those phrases and those analogies, but it does make sense. You don't just have perfectly healthy teeth and then 10 seconds later you have a toothache.
Yeah.
It's a process that sneaks up on you and you don't have symptoms until it gets to the late stage. So we're constantly re-educating and teaching patients that the patients have to be patient. It is a process that takes time to heal. Even if you have a simple cut on your hand, it doesn't heal in 5 seconds.
No.
So that is healthcare is a process and takes time.
Well, and I know just for me, some of my symptoms, I'm overweight, and that doesn't help any because the extra weight pulls.
Right.
And and then probably America in general, like maybe even the world in general, like we're talking about proper diet. We live in such a fast-paced world that we have to run here and get something and run there and get something because we're in a hurry or couldn't stop and actually eat a good meal.
Right.
So we eat sometimes that junk food that that we don't need. And,
right.
And next thing you know, it's more and more. We stop and make those short visits, and and that all takes into account of our health.
Oh yes, yeah, and it's a habit that you can retrain to a healthy habit. And there's so many there's companies and individuals that do pre-prepared meals, and you can order those and you can either have them delivered, and there's a local company that does it. But I said it's a matter of effort. Really, life comes down to a matter of effort. If you put the effort into it, there's tons of information on the internet. How do you eat well? How do you choose even off of a restaurant menu? You can either eat the keto or low carb or something similar. But if people just put the effort into it and look for the information that's out there. Right,
and I know you talked about the meals. My wife and I, we use one of those meal deliveries, and I think it's 3 meals a week.
Right.
But we had choices of the low carb, or there's several different choices you can choose on the plans, and then they send you those meals. And if people think they're not good, they're wrong, because they are good meals.
Yeah.
And they send good stuff. I mean, and some of the things that are in those meals I've not tried before. Some of the ingredients, and once we put those in there and ate the food, I thought, well, this is pretty good. I'll have to try that out. So there's things out there for everybody.
Yeah, exactly. There's options, plenty of options.
Well, if excuse me, if someone needed your care, of course, your office is just right down the street. Right across from the Untitled Church of Christ.
Right.
And what's your number that they can reach you at?
is, of course, 423-949-5599. And if you want to go to the website, I think there's really interesting articles and videos on there. It's www.drlong.net, drlong.net. And you can message us through there and email us if you have questions about anything that we've discussed today or any other questions. Feel free to send us an email straight off the website.
Well, is there anything that maybe we've left off that maybe you'd like to add that we need to talk about?
Maybe one thing is there's so much misunderstanding of, I think the general public understands that we can help with simple low back pain and maybe headaches, but we treat so many other conditions beyond that. You know, car wreck injuries, sports injuries, carpal tunnel syndrome, plantar fasciitis, a lot of these conditions, and even my established patients that may have been with me for months or years. We had a lady from out of town the other day that mentioned her feet were hurting, and I asked her a few questions, and she said, well, I didn't think you could help with that. So I gave her my unique treatment for plantar fasciitis, and it was immediate. She had relief before she walked out of the office. So she's telling her family and friends, and I said, always ask, and if the answer is no, that's, if I can't help you with the condition, I'll tell you no. But there's a lot of conditions, soft tissue injuries, simple sprain strains, like I said, migraines, cluster headaches. There's a lot of conditions that we can help with that most people from the general public just don't realize. And if you have any questions, go to the website or call the office and ask. We have people routinely ask, but the general American population thinks that we can help with simple low back pain for adults. They don't realize we can treat pregnant patients. They don't realize it's even, it's safe for kids and effective, and and a lot of these conditions are something that the average person wouldn't even consider going to the chiropractor for. So that's what we're trying to educate and change the mindset of. It never hurts to ask. If I can help you with it, fantastic. It's safe and effective. All the research proves that this treatment worldwide is really, really safe and effective. And number two to that statement is we're highly trained to know what our scope of practice is, what our limits are, and if we see something we can't treat that's strictly medical, then we refer out for it.
Right, and I know we have a place here in town that treats like the sports injuries, but you would also be able to do that as well if it wasn't too advanced out of your area.
Yeah, as long as it's within the scope of my practice. I've had some additional post-grad soft tissue training from some doctors, one from England and two from America years ago, and that's been really, really helpful in helping the athletes. We treat all kinds of athletes, football, baseball players, basketball, of all different age groups.
And one other thing I might want to point out to your patients that I know you are constantly reading up and getting new information and new educational stuff, so you're constantly learning things about chiropractic.
Yes.
And so it's not like I got my degree and I'm a doctor now.
Right.
You're constantly going for new stuff.
Yes, exactly.
And I know you've been to different meetings and things like that, and to learn more and to hear from other speakers and so forth.
Yeah. I go for extra training above and beyond what's required. The continuing ed requirements for each professional in each state. But so we have to go for 24 hours per year for that. But I study above and beyond that.
Well, that's good to know, because people need to understand that you're not just, well, I learned that 20 years ago.
Right.
Right. But because things change.
Yes, it is.
As we mentioned.
And
so, well, Monty, I appreciate you being with us today, and I appreciate getting you here. And I know we've had our schedules, been trying to get our schedules together for a while, but I appreciate you being here. And folks, if you have any problems, go see this man. He's a good man. He'll fix you up. If he can't, he'll get you to somebody who can. So we appreciate you. Look for us on the BTC Fiber YouTube page, as well as Channel 18 of BTC Fiber's cable channel. And until next time, we'll see you then. Hey everybody, this is Glenn Edison from Valley Views. We appreciate you watching our shows, and we would like for you to like, share, and follow us on Facebook, as well as like and subscribe to our YouTube page.
Brought to you by Bledsoe Telephone Cooperative, your full-service telecommunications provider right here in the Sequatchie Valley.